I'm Dr. Sandy Sandbar. This presentation deals with reasonable informed consent. The legal concept of informed consent arose in the late 1800s, and that was in connection with moral considerations concerning involuntary and highly unethical human science experimentation. This has been rectified in part by the post-war World War II Nuremberg Code. In the case of USA versus Karl Brandt and et al., it's also known as the doctor's trial. 23 doctors and administrators were prosecuted in 1946 and 1947 for organizing and participating in war crimes and crimes against humanity in the form of medical experiments and medical procedures that were inflicted on prisoners and civilians. The doctor's trial stated that humane experimentation is justified only if its results benefit society and it is carried out in accord with basic principles that satisfy moral, ethical, and legal concepts. The Nuremberg Code set forth ethical research principles and standards which were used to judge physicians and scientists who conducted biomedical experiments on concentration camp prisoners. In 1979, the Belmont Report identified basic ethical principles for conducting research that involved human experimentation and subjects. And that set forth guidelines to assure these principles are followed throughout the research process. Legally, based on the principle that a person of the age of majority and sound mind has a legal right to determine what may be done to his or her body, informed consent means that healthcare providers must disclose information to their patients that will allow them to make intelligent choices regarding their own medical care. In the landmark case of Canterbury versus Spence, there was a young man. He was advised by his physician to undergo laminectomy in an effort to alleviate back pain. The physician did not advise the patient of the risk that 1% of laminectomies resulted in paralysis, which the physician was aware of. He believed that the patient might reject the useful treatment. Following surgery, the patient fell from his hospital bed, and became paralyzed. The cause of the paralysis was either the laminectomy procedure or the patient's fall that remained uncertain. Well, the patient sued and alleged that the physician failed to inform him of the risks associated with the procedure. The court held that the standard measuring physician performance is conduct which is reasonable under the circumstances. Instead of adhering to the community disclosure standard, physicians are now required to disclose information if it is reasonable to do so. A physician must explain any benefits or risks that may be significant to the particular patient, who may be a singer, piano player, or an athlete. The information should be personalized about how the treatment might reasonably affect the particular patient. In another case, Gates versus Jensen, the physicians are required, according to the court, to disclose personal or economic interests that may influence their judgment. And in Jandre versus Physicians Insurance Company of Wisconsin, the physicians were told that they should disclose all diagnostic tests that may rule out a possible condition. And still in another case, Nixdorf versus Hicken, a doctor left a surgical needle in his patient's body. The court held that the physician has a duty to disclose any information pertinent to the patient's treatment, including the patient's physical condition following treatment. The physician must disclose information that a reasonable person in the patient's position would find important. And in Truman versus Thomas, a woman had refused pap smear. Subsequently, she developed cancer of the cervix and died. In that case, the court held that a physician had a duty to disclose to the patient the possibility that precancerous cells might develop uncaught into cervical cancer if she declined to undergo the procedure. The refusal requires disclosure of potential risks associated with seeking treatment and must be an informed refusal. There are exceptions to the informed consent, and the exceptions are three. The exceptions to the informed consent include, number one, the incapacitated patient; two, life-threatening emergencies with inadequate time to obtain consent; and three, voluntary waived consent. What about children? Children, typically under age 17, cannot provide informed consent, with the following exceptions. Children under 18 years of age, if they are married. Number two, mothers of children, married or not. And those under 18 who are serving in the military. And finally, those who are able to prove financial independence. States have one of the following standards for informed consent. The first is what is called subjective standard, what the patient himself or herself would need to know and understand in order to make an informed decision. Very few states have that, such as Oklahoma. It follows that standard. The second type of standard is the reasonable patient standard, sometimes referred to as materiality standard. What the average patient would need to know to be an informed participant in the decision. This standard has been adopted in the states of Alaska, Arkansas, Hawaii, Indiana, Louisiana, Massachusetts, Ohio, Oregon, Pennsylvania, Texas, Utah, Washington, and West Virginia. These states have designed a framework of informed consent that underscores and protects the reasonable patient's choice. Lack of informed consent is established in court when a reasonable person in the position of the patient would have decided against the treatment. And then the third type of standard of informed consent is called the reasonable or prudent physician standard. That's what a typical physician would say about this procedure. This is followed in many states from California, Delaware, Florida, Georgia, Idaho, Maine, Michigan, Missouri, Nebraska, etc., and in New York. These states have crafted a framework of informed consent by underscoring the notion that doctors know best. Lack of informed consent is established when the patient shows that the treating physician failed to inform the patient, and that was not a reasonable decision by the patient. A reasonable physician would have told the patient based on the circumstances. Regardless of which standard is applicable to any given case, or what state definition applies, informed consent should involve elements of both the patient and the physician standards, thereby bringing together concepts of shared decision-making. Patients and their healthcare providers should collaborate and communicate with one another in clear, transparent, and honest fashion. This ensures providers are given their best chance to provide the best care possible, and their patients are given the best chance to overcome their fears and ailments. A most reasonable approach to informed consent and informed refusal is to view the process as a collaborative one, which allows patients and healthcare providers to make decisions based, especially when more than one reasonable alternative exists, and both of them are involved, the patient and the healthcare provider. The process must also account for the patient's unique values, beliefs, goals, preferences, and priorities, and the best available evidence-based medicine. In conclusion, the legal standard for lawful behavior is the objective reasonable person. This is a fictional or a hypothetical person who approaches any situation with the appropriate amount of caution and then takes action sensibly. Well, in the case of informed consent, we have to consider the type of informed consent that is available in the state and make sure that we abide by those standards of the state. Thank you.